Hello and welcome to another episode of Right Brain Rounds. Today I have Dr. Susan Baumgaertel with us, and she is a new author, giving us so much wisdom in her new book called The Menopause Menu. And she is also the founder of My MD Advocate. And we're going to talk a lot about her book today and how it can help our listeners and who her target market is when she wrote this book. And welcome so much.
Thank you. I'm just delighted to be here. Thank you for having me. And what a great day to talk about my book.
Awesome. So tell us why you wrote the book. I'm just so intrigued by it. I mean, in reading the book and as an OBGYN myself, I mean, I can tell there's a lot of passion in your passages.
Well, thank you. I have lots of answers to this question. How I kind of came to get the idea for this book really reflects on 30 years, 25 years, 30 years of caring for women. I drew inspiration from my interactions with patients over these years. And really, I think it was clear that more information was needed about the entire menopause journey, and that this information needs to be both evidence-based and holistic. And so kind of putting that package together. And I kind of harken back to 2012 when I developed a program called Menu for Change. It ran for 7 years, and it really engaged in a lot of different ways to help women navigate weight management, although it really turned more into a wellness program. So the focus was on nutrition and movement and sleep and stress management, all those things, of course. And it seemed really like a natural extension to frame information about menopause and midlife transitions with a menu-based theme. And so I launched my free website, Menopause Menu, in late 2020, and this all led to the foundation for my book.
That is excellent. And we'll put all of this information in our show notes at the end too, like how people can connect to your website, how they can purchase the book, and, look at all of the resources that you provide for free, with all of the knowledge that you have from taking care of women who are going through menopause, for so many years. So when you think about that and the My MD Advocate practice that you started, what is the feeling that you get from interacting with women who have lots of questions about menopause? And do you feel like they're comfortable asking these questions? I mean, I feel like putting a book out there about it kind of opens the door to that conversation that you have with patients, to make it a little bit more accessible and easy to talk about.
Yeah, no, I think that's true. I will just add that my business, My MD Advocate, is not about menopause. It's really about helping everyone. But certainly a portion of my patients are seeing me because they know that I have an interest in that. I think
Sure.
really, when I think about what's the best way to care for women, it's to listen. It's to make space to listen to them, to help guide them, because fortunately and unfortunately, menopause is just everywhere these days. You can't open the New York Times or the Washington Post or whatever it is. There's some article, maybe it's menopause in the workplace. And so it's literally everywhere. Of course, you know what happens when that happens. And there's the snake oil salesman and things that are just kind of woo and not supportive. And so people trying to make a buck. And I think that unfortunately, um, there's a lot of discussions that just get polarized. It's like all about hormones, or it's all about not hormones, and it doesn't have to be that way. And so menopause is so much more than just about the hormones. And so if you kind of expand that definition and look at all the things that might be happening, then you can be there and present for a patient who is, let's say they have brain fog, or let's say they have vaginal dryness, or let's say they have stress in their family, or maybe, their hair's falling out, and all these things that, may or may not be caused by menopause or stress or whatever, but they all overlap. And so I guess really it's making space, being available to listen, and not to kind of put someone in a box because it's so complex.
And I know that, a lot of times in medicine, in talking to patients, I know I did an OBGYN residency, and before I had children, you know, counseling patients was totally different than after I had children. Do you feel that you can bring a lot of your personal experience into the exam room and, when talking with patients about anything, you know?
That's an excellent question. I remember years ago someone asking me, um, well, how can you advise me about my cancer if you've never had cancer? And it was a specific kind of cancer. I thought, like, wow, that was it wasn't a put off comment. I mean, it was really a valid question. Like, how do you really know what I'm going through? Interestingly, I've been the president of the board of an amazing nonprofit called Cancer Lifeline, and I've definitely learned about supporting people with cancer, not just as a physician. But that always rings true to me because, yeah, I've gone through menopause. That was a number of years ago. I've also had a child. So if I hadn't had a child, how much of the childbearing process would I know, or being a parent? If I hadn't gone through menopause, what would my personal discussion be? I think it would be more clinical, perhaps. I would hope I'd be highly educated and read and get information from others. But I think you're correct. Having gone through an experience lends itself a different flavor to how you can help people. It's not comparison. We're all, on a unique path, but there's a lot of common themes. And so I think perhaps maybe in the most basic sense, I have more empathy and hopefully more understanding, and maybe more patience and tolerance because I know how intricate it can be. So yeah, it's a really good question.
And I also love how in the book you do throw a little bit of humor into it. I mean, it is something that a lot of people go through, but if you can't see the humor in it, I mean, then what are you learning?
Right. And actually, I'm glad you got there is some humor in there. I think I can make almost anything kind of uplifting. I
Mhm,
think that my intent was when I set out wasn't to have a medical tome, a very serious
mhm,
reference book where you had to look up every third word because unless you're a doctor, you don't know what the word means. On the flip side, the whole other end, I didn't want a fluffy, throwaway kind of, insulting thing that most people, yeah, I already know this. Why is she saying this? I wanted something in the middle, whereas there was substance, there was evidence-based, science-based data, information, a resource. But I also wanted it to be in a very artistic and uplifting and friendly way. I know it really added to the cost of the book in terms of publishing it, but they're like 35, 36 colored pictures. There's art in there. There's haiku, poems, quotes. There's, recipes. There's a recipe for each chapter. So it's an experiential book. And so you get information, but it's also something where you kind of think back to when I was a child and there were coffee table books, usually art because my mother was an artist. And, you'd see Georgia O'Keeffe or Emily Carr, and the group of seven, and you just think like, oh, you could open that book and it sits on your lap for 5 minutes, you enjoy something and you go off and do your day. Well, that's the book I created. You don't have to read it from start to finish. You can just open a random page and just kind of enjoy what you're looking at and also maybe learn a few things too.
The other part that I really love about your book is like you said, the quotes that are kind of thrown in there from women who have been through menopause or, have questions about it. And it makes it really relatable. And like, oh, I could have asked that question, or, oh, that's a question that I had, but I never would have said that in the exam room. I think that makes it so relatable. And, when you're talking about your target readers, it's such a great resource in that way.
Yeah, before the book, when I was getting my website together, I interviewed, oh, it must have been about 80 different women patients who answered a set number of questions and wrote in responses. And I have no idea how I figured this out, but I had the foresight to say, sign here. So if this ever gets put into a book, I don't have to get your permission. Well, that was interesting because I used a lot of that in my book. And I think it really makes it tangible. It makes it valid. I think many women can say, oh gosh, yeah, I get that too. And so it makes it more, the experience more human.
Definitely, definitely. And When you founded your practice, and I'm not sure if I'm calling it correctly a practice, but the My MD Advocate. Just tell us more about that, why you did it, and how it's different than traditional, a patient goes to see their physician type medicine.
Yeah. So after practicing full-time clinical medicine, inpatient, outpatient for 25 years, I pivoted for lots of reasons and decided to open my own business. And I really thought long and hard about what I wanted to create. I knew that I wasn't retiring. I wasn't, stepping out of the field of medicine, but I didn't necessarily want to do the hands-on primary care. And so my MD Advocate formed as a way for me to still be of support and service to patients in terms of like medical consultations and advocacy, and also be there to support my colleagues. And that was really important for me. It wasn't like, this is my practice and I'm taking away your patients. It was like, wow, acknowledging so many of my colleagues are super busy for all the reasons that we know, and maybe don't have time to sit down for, gosh, who has an hour, talk to someone about their cholesterol or about their stroke risk or about their, parents' poor health or about their mental health. And just the list goes on, but I can. And so I can support this patient, and I can also support the plan of their physician or their specialist. And to me, that's a win-win, because I'm kind of filling that gap and supporting patients in the way they need it, not to thumb my nose at anyone in the medical sphere, but to acknowledge that my colleagues are busy and overworked and exhausted. And so what better way than to kind of, partner together?
Sure. And I can totally understand how that kind of help is very good for the physician who's caring for the patient, but then also to help with that patient to get to where they need to go, and ask the questions that maybe they didn't have time to ask during that one-to-one appointment that they had with their, original physician. And then being in that field for so long, all of the ins and outs and the ways to, get people to where they need to go. And, having that time dedicated, it's like an extender of, that patient doctor relationship, like with their primary. So that sounds excellent. I bet it's very rewarding.
It is. And I think, who knew I would love to work for myself and be my own boss. I think I also like that I could, I can parse out my time. We always preach to our patients about self-care and being kind to yourself and wellness and mindfulness and all that. Well, can't do that if you're working 18 hours a day nonstop. And so I do have time to attend to things that make me a better physician and a better person, like writing my book, or maybe it's blogging, or doing photography, or things that are meaningful to me. And I think that that's hard to do when you are buried in traditional medicine these days.
Mhm. And a lot of times, even just as physicians, a lot of us identify as a physician, and that is what we are in life. And a lot of times we're not encouraged, or we don't let ourselves explore the human side of being a physician because we're so busy taking care of other people. And like you said, taking the time to do things that bring you joy, like photography, or getting 8 hours of sleep at night, doing the things that we encourage our patients to do to care for themselves. Making sure that we have our oxygen mask before we start, delving them out to everyone else. So
So true. So
yeah,
true.
yeah. Is there anything that you've learned through being your own boss and doing medicine in a different way that you could, just tell the listeners about, that something that you've learned that could help them in their journey of being a physician and, looking at how they practice medicine?
That's a loaded question. I think um, it's hard to find one answer. I do realize that after I shifted and pivoted away and started my business, I ended up having coffee or going for walks or meeting up for lunch and just chatting with, like over 50 different colleagues, maybe 60. I was just phenomenal, all different specialties. And it seemed that they were excited to stay connected, and I respect my colleagues, and it was great to have this massive friendship circle. But I recognized that so many of them were utterly exhausted. I mean, just beyond, like, to their soul. And I remember that. I remember that. And I remember feeling that, like, when you don't have time to go to the bathroom, sometimes you're so busy, every physician's nodding their head. And the exhaustion that comes with that, the fatigue, and it's not just physical fatigue, it's mental and emotional fatigue. And so I think that my creativity did not kind of pop back up until I was really stepping away from that kind of cycle. And so it can be hard for someone who's in the midst of an extremely busy, complex career, and maybe in their weakest moments or on a vacation, or when they have a moment to themselves, they think, gosh, I don't want to do this forever. What can I do differently? But it's almost like a fleeting thought, because it takes too much energy to like think about, well, what could I do, and what are the realities? And so I think I was just really a beacon of hope, kind of saying, like, hey, there are things you can do differently. And we all know, and hopefully I'm preaching to the choir here, part-time in medicine is never part-time, it's full-time, so unless you're working 1 day a week, like your per diem, it's just, you're kind of consumed by your profession, and rightly or wrongly. Rightly, because that's our passion, that's what we went into this, to care for people. It, like you said, it defines many people. But until you step away, until you have that breathing space, that time to sleep and reclaim your sanity, you just don't know the possibilities. And actually, there's so many different possibilities, it's just hard to fathom. So I guess I would just, give encouragement to anyone to look for those pauses, those ways to truly step away and kind of think about what you might want to do differently. But it takes a lot of energy.
Yeah, I mean, I can think of an experience in my life where I broke my leg, and I was working full time, and just very busy practice, high risk obstetrics, and I physically and emotionally had to take a break. I was non-weight bearing for like 9 weeks, and it really gave me that physical and emotional time to pause and think, is this what I want the rest of my career to look like? It was a really tough time. And, you know, encouraging people to do that, like not with a trauma or, some huge life event like what I had, to realize that, I probably need to start my own practice so I can practice in the way that I want to and have that autonomy. Um, you know, Encouraging people to explore other options in medicine and other ways to do it. I mean, you don't have to always do the traditional route of providing, your services to people. You can do it in a different and creative way. So I'm really happy that you've followed your passion in writing the book and also starting my MD Advocate, because it's such a unique way of providing care to patients, but then also, your colleagues, like you said. And I think, a lot of us who, come on this podcast, I interview a lot of physician coaches and physicians who are coaches. And they all have a passion for helping people, and it specifically includes helping their colleagues. So um it's a really great point that you bring up, as far as like, you know evaluating your career and trying to figure out how you can take that exhaustion like element off of the table in any busy career that we have, because we just think so much all day, every day. There's always something.
True. Yeah, that's so true.
Yeah. So in starting this practice, where you're helping people, what is something that you've found to be the biggest challenge?
Well, I guess in stages, so my practice is telemedicine. I don't have a brick and mortar office.
Mhm.
That to me was a mental hurdle to get over because I'm very much a people person and, hug people and, connect with them in person. But at the same time, I don't shun technology. I embrace it. And so I felt like, this is going to be interesting to relate to people just through my computer screen. But I realized, the vast majority of the time, the computer screen melted away and I was there talking with someone. And so in a way, it hasn't changed how I can be of service to someone or what I can offer them in terms of advice and counseling and dialogue and advocacy. But it's a different flavor because it's not in person anymore. I think the as my business, in February it'll be live for 2 years. I can't believe it. I think it's flourishing. This type of service is needed, but I also am very aware of changing to meet the needs of different people. An example is someone who's um, uh, well, the patient was ending up in the hospital twice in a behavioral center. And I had known her for years. And then her family wanted me to help kind of post discharge and kind of get engaged with a lot of things. And I kind of stumbled a bit because I thought, oh, wait a minute. In my previous scenario, when people are in person, they'd all be there as a group together in the exam room together as a family, and I can talk about strategies. But who's the patient here? Is the patient still the patient, or is the patient now the husband or the daughter? And so it became a little confusing. Maybe I was confusing myself, thinking about who am I representing and who am I caring for. But once I kind of adjusted to that, it was a good fit. But so these are different scenarios than I would have had in my previous primary care practice. But I think those are great examples of how we can adjust and we can still look at what kind of advice or what kind of services I can offer, and I just have to modify it. So a learning curve for me on that one, but I think I'm embracing things as they come.
Sure. And do you feel that with the pandemic and telemedicine, telehealth, becoming a little bit more mainstream than it was prior to the pandemic, do you feel that that was somehow a silver lining for you and your practice?
I think the answer ultimately is yes.
Mhm.
I believe that if we didn't have the entire world and certainly our country, everybody knows how to Zoom, right? If that hadn't happened, it's kind of pulling teeth to get people hooked up and online and get the video work and the mic work and figure out how that all those things work. So yeah, that was all done for me. It was just a matter of making sure things are, in the medical world, HIPAA is very important in terms of privacy, and those things can't just be done over a simple Zoom if someone can kind of, pirate in and see what you're talking about. So that the technology's there. It was pretty straightforward to figure out. So yeah, I think that the pandemic weirdly enabled probably not just me, but so many people to be able to connect with others in very important ways. And probably is, my business may not have been able to flourish in the same way if it hadn't existed.
I think the other thing that a lot of private practice physicians or people who are doing direct primary care or cash pay services, at this point in time in our world, struggle with is promoting themselves, promoting their services, marketing their personal physician brand, and feeling okay about it. I think just knowing that there are people out there doing similar things, maybe in a very different way, but who are out there, trying to create a different system within medicine that can really connect with their patients without using insurance as a middleman, or interfering with the care of a patient, that they're kind of trying to figure out how to promote themselves and be okay with it. Like, marketing feels slimy to a physician when really it's a business. So do you ever feel that way? I mean, I feel like networking is the best way to kind of get over that. Like you said, you met with so many, physicians, and I mean, how do you feel about marketing, and what would you tell other people who are in similar situations, like just getting their own practices started?
Yeah. Oh, great question. I
Mhm.
think marketing can have so many sides to it. We know the slimy car salesman kind of approach, and the pharmaceutical industry, and just kind of things being shoved down your throat, direct to consumer marketing on the TV. It just gets too much. That being said, the vast majority of physicians, if not almost all of them, are just not accustomed to tooting their horn or promoting their business. Maybe some industries are, perhaps plastic surgeons are the best example, when they have to have a nice portfolio and show what their work is. But I feel like it's certainly not a skill you'd ever learn in med school or beyond. And it was foreign to me to think about promoting my, product, so to speak. I'm my own product. But quickly I realized that, very much I'm a grassroots kind of gal, and one-on-one really works for me. And so all these, coffee dates and walks and talks, and connecting with colleagues in the right way, different than, mass marketing brochures or taking out an ad on Facebook, which I've never done. And then, selective social media. I think, again, physicians from the get-go are rightly so, are advised and counseled to be cautious about use of social media in most of the sense of how you'd use social media. But that became kind of a pedestal or a platform. And one example would be like LinkedIn. I think that's where you and I met, and other physician colleagues around the country who have done a great job at providing platforms for interaction. And so that became just as important, because nowadays, my book tour has been online, right? I haven't driven from city to city or flown from country to country. So there's so much that can be done online that you just, that it's like the world's your oyster. So changing the kind of the feeling of what marketing means, using it as a great tool, using technology, using the advantages that marketing has, but in the right way. I mean, I've seen quite a few, I'm sure you have, physicians who, market their stuff. It's like, oh my God, here we go again. It's not the right way. This is, getting back, for instance, to my book, I never wrote it to make money. I never wrote it to be famous. I know you wrote a book too, and you're very passionate about it, and you have another book launch tomorrow. And I feel like, for me, it was reaching out and just kind of seeing how it might benefit women, and of course men everywhere. That was the passion part of it. So I think if you market with honesty and integrity and passion about something, it's going to be a win-win. It's not going to be that slimy, marketing feel.
Yes, and using the book as a platform to get your message out to the people that you're targeting, and saying, hey, I can help you. you know and I think a lot of us, it always sounds cliche, but we went into medicine to help people, and um in doing it in a different way by writing a book, I mean, I think it's amazing, and I definitely have learned quite a bit from your book, and you know want a lot of people to check it out. And um I mean, you can just tell that you know a lot about the subject, and that you're there to help people through that part of their lives, which can be tough for a lot of people.
Well, and I think, like, maybe not just medicine, but almost anything we do, it has to have that human experience, the human part of it. As we're rising up into an AI world and technology assisted, and there's almost a little dystopian feel sometimes about that. We have to ground ourselves, I think, in the human aspect of things. I did want to actually, if you want to humor me, take this opportunity to read a passage. It
Yes.
kind of dovetails into what we're talking about. So my book has 16 chapters, and there's one chapter on body image, which, of course, as many women know, as they're going through menopause, that can be a very challenging time when things are changing, and maybe you're self-conscious, or you're not comfortable with how you look or feel. And there's one section that's in the dessert section. So my chapters all arranged like a menu. And it's really just a personal story. And I'm just going to read a paragraph because it's a long one. So that it's talking about, it's aimed at women who are still having trouble after having read that chapter, still stuck with kind of not being happy with a certain body part. And this is on page 100. So I remember when my mother, an artist, did a lot of life drawing back in the early 1980s. She was part of a group of artists who gathered weekly at our local art gallery, the Art Gallery of Peterborough in Ontario, Canada, in a private heated upstairs room away from the public exhibits. A college student trying to make extra money was hired as a model each week. The student was pose naked on a raised plinth, sometimes standing or seated in a chair, in various poses as directed by the group. The room had a quiet intensity as each artist rendered the figure with charcoal or Conte crayon, intimately transcribing the shapes and folds of the human form onto paper. I joined in one session and vividly remembered the beauty of a nude figure seen through artist eyes. How refreshing it is to truly marvel that every body is unique. And, I tingle when I read that because I remember that vividly. I was much younger, but, again, it's, relating to people in a human way and turning this maybe not so happy experience of not liking what your body looks like into more of a magical experience that lets your kind of mind wander a little bit. And I love those moments.
Yeah, that is just so amazing. And, the creativity, you know, the explanation of the experience and how you can turn it into like a life lesson that yes, everyone is unique in their own way, whether it's their body, their mind, their thinking style. I think that's just totally amazing. And, to really put it out there in a world where social media, magazines, models, um, kind of promote an unrealistic idea of what it means to be healthy or what it means to be beautiful. Yeah.
Definitely, especially for women. Yeah.
Yeah. Yeah.
Yeah.
Wow. So, in closing, what would you advise people who are just trying to make a change in their health, in their life, um, if they're getting towards that age where they might be going through menopause or, you know, perimenopausal? What's your biggest word of advice for those people?
Well, with a straight face, I'll say, buy my book.
Yes.
That's why I wrote it.
I second
Yeah,
that.
that was a joke, not a joke. I feel like I've said this my whole life. I think, especially for women, especially at this time in their life, you need to have established with a good physician, someone that listens, someone that you can access, someone that you trust, and hopefully someone that knows you. Not everyone has that luxury, and I know that's kind of privileged these days. But that's really the cornerstone for really getting good care and to be listened and valued and supported during this transition. So that's always on the docket if someone is healthy and maybe hasn't needed to see a doc or just kind of drops in now and then for random visits. But it's getting someone who knows you because there's a lot that's going on. This is midlife. And when you think about what's going on in midlife for women, we think about cancer screening or heart disease screening or diabetes screening or osteoporosis screening or treatment of those things I just mentioned. So there's a lot there to not lose track of. It's not just about hot flashes and night sweats and sleep disruption. But I think also just really to look for ways that you can support, that you can get support around you. I mentioned earlier about, menopause in the workplace. Maybe there are some things you might change up a little bit, or if you're just a worker who has no say in their environment, maybe there are things that you can request of your supervisor or your boss. So empowering, I know that word is almost overused, but empowering yourself with validating, when do we get support if we don't ask for it at this time in our life? It's different than if you happen to be a woman who has been pregnant and then you deliver, your baby's delivered. There's so much support around being a pregnant woman or a new mom. it's different when it's at the other end of that spectrum, thinking hormonally, that support isn't kind of as visible and as readily available when you're going through menopause, because often there's a lot of things that you're not talking about, or maybe they're embarrassing, or they're just, you're too busy because life has its twists and turns. So getting that support in place, being vocal, getting a physician who cares and who listens, and having a little fun with it too. I think we need to sometimes poke fun at ourselves and be a little humorous and lighten up a little bit and realize that we're all on the same journey.
So true, so true. Well, thank you so much. I really appreciate that you were here today, and I really enjoyed your reading from your book. And we'll put all of your links in the show notes so that everyone can connect with you and find the book and your other resources on your webpage and My MD Advocate. Thank you.
Thank you for having me. It was a pleasure.